Hi, I'm Dr. Nicole Vane of Moonlight Dental. I did another video on the safe amalgam removal technique and the steps we follow here in the office. Want to talk a little bit about the differentiators, about how we do it. In this modern world, especially in the wellness community, people are really looking for wellness providers. So instead of holistic and biologic dentistry, there are a lot of people now calling themselves wellness dentists. You might want to run from that because what we call them in the true biologic community is faux-listic, meaning not holistic, faux-listic. I want to talk to you about some of the things to look for. Not only should you look for the safe amalgam removal technique, which is in another video, but I also go above and beyond because I've done so much extra training. So underneath the rubber dam, the barrier we would use to protect you, we also use Amalgam X cream, which is an additional barrier that you can put on. I put it on under my gloves. We can put it on your face underneath the rubber dam. And we also put 2 additional barrier and covers over your face so that none of it's going to penetrate through your skin. We all wear these special gowns. Again, you can watch that in the video. But the one thing I do that's super unique that no one else does is I give you some binders and some supplements to help flush out any escaped mercury. So my favorite way to do it is through IV. I put in a lot of IV vitamin C and glutathione. What are those? Those are powerful antioxidants. Glutathione's the one we should make ourselves. The vitamin C, you want to getting it straight in there so it's pushing out all the mercury, but also replacing everything with a good antioxidant. I also use binders, so I have you rinse afterward with charcoal, activated charcoal, but I also give you a binding powder to swallow. This one's from Quicksilver. It's called Amalgam Clear. It's going to bind anything that may have gotten free in your oral tissues, and it's also going to push it out through your feces. I'm going to give you some chlorella and spirulina. These are not great binders. You may read that you can take them on your own at home. They're never going to hurt anything. Same thing with cilantro. It's great to have that added benefit. They're just very weak binders. That's why I like to incorporate stronger ones with my procedures. And then we chase that with some liposomal glutathione, liposomal vitamin C, and I like to go an extra level because that's just how I am. So I then do methyl charge, and if you're MTHFR, I'm going to give you an additional supplement for MTHFR. Those are the extra steps I use. I want to just go above and beyond for my patients. I haven't even hiked up my fee. I am less than any of the other providers that I work with. So if you're looking for safe amalgam removal, this is the place to come. Come to Moonlight Dental.